Hello. Welcome to the first community conversation, Gun Violence Prevention through Community Engagement. This program is funded by a Libraries Transforming Communities grant through the American Library Association. Libraries Transforming Communities Focus on Small and Rural Libraries is an American Library Association initiative that helps library workers better serve their small and rural communities. This program is co-sponsored by Carbondale United and the Carbondale branch NAACP. So I'll just tell you a little bit about our agenda for the evening. We're first of all going to hear from our panelists who are going to talk about the gun violence prevention work that they're doing in the community and that they're wanting to see happen. We then will open up for community comments and questions. And then we'll talk a little bit about what's next, both for this type of work in our community and for this community conversation series. We'd love to hear from you about that. So this is our panel for today. We have Joe Cervantez, the Jackson County State's Attorney, Nancy Maxwell, the President of Carbondale United, Diana Brawley Sussman, the Director of the Carbondale Public Library, Chastity Mays, a founder of A Gift of Love charity, Clare Killman from the Dispute Resolution Institute, Aaron Lee from the Denman Center, and Dollean York-Anderson from Family Advocacy Services. So I'd like to go ahead and introduce our first panelist, Joe Cervantez, the state's attorney from Jackson County.
Hi, good evening, everyone. First off, I want to thank everybody for tuning in. And I'd like to thank you for the opportunity to be here today. It's always a good thing to be able to have a platform to reach out to the community, and I think that this is one of the best ways that we've been able to do so through programs like this. So I don't want to waste too much time talking about myself or introducing myself. I think many people have heard my spiel about my background and what I do and the types of policies that I believe in. Since I've taken office, it's been eye-opening to not just be a prosecutor again. Being a prosecutor or an assistant state's attorney is much different than actually being the state's attorney. I've learned the hard way a lot of valuable lessons over the last several months. One of them is about violent crime. When I campaigned, I talked a lot about making sure that we were firm on violent crime, but also at the same time, trying to make sure that we didn't keep feeding people into the pipeline of the criminal justice system. And I often explained it as making sure that we're filling holes in the boat and not just bailing water, trying to do both. In other words, work on both ends. I consider, the best analogy as a pipeline where people enter it in a lot of different ways and different manners. One of the things I've noticed is that there's not one reason for an increase in crime, violent crime, but there has been an increase in violent crime. And I'm not just talking about locally, I'm talking about nationally, without a doubt. In a July 2021 Washington Post article, it explained that there has been an unprecedented rise in violent crime, not just in many cities or in one particular city, but across the country. It also explains in the same article that there's not one reason for it, or there's not an easy way to find out why that's happening. And so just like the problem, the solution is multifaceted. It doesn't have to do with one answer. Because not one thing is causing violent crime. It has to do with making sure that our approach is multifaceted, as I've said before, but now it's more obvious than ever. Recently, we've had some shootings in Carbondale, more so in the last couple of months than before. And one thing that I've particularly noticed being in this seat is that it's necessary to read every report that comes in and out of the office. And one of the things that we've done is made sure that I have hands on every report that comes in this office. One of the things that I've noticed is that the same characters are involved in many of the violent crimes in Jackson County and in Southern Illinois generally, but mainly in Jackson County. We can link several of the crimes to just dozens of individuals. And looking into it, many of them were in our juvenile justice system right here in Jackson County. Also, all of them were in school, were chronically truant, and had contact with law enforcement while they were in school. This should let us know that right now what we're doing is not necessarily working, and that we don't necessarily need an overhaul, but we do need an approach that takes it from the entire pipeline, which means we're working on a policy program right now for truancy. We're on different pages when truancy comes into play. One school district does it different than the other, even though the flow chart is promulgated from the state of Illinois. So we have a person right now from the Illinois, from the Paul Simon Public Policy Institute, working in our office now on a truancy program. We also have to make sure that there's youth programs. And we're working on several of those, but I know a lot of other people in the community are doing that as well. And I'll continue to reach out to the community to make sure that we keep up with that and that I give them the support they need or that I can from this office. And we also are working with young individuals that are in the juvenile justice system now. Those programs are very difficult to install because the juvenile justice system is very quiet and very private, but we are working on diversion programs where myself can be involved in those diversion programs. And finally, once we've prosecuted someone for a violent crime, we're giving them opportunities to come back in statements of allocution and use those for kids and youth in the community to let them know where they went wrong and how they would do things different. We're also working with a number of community groups on some intervention ideas. So all those things, and lastly, I forgot, I know I'm taking too much time, but the last thing is that we also notice a very high recidivism rate of juveniles who are getting out of IYC, out of prison. Their recidivism rate has skyrocketed. And the aftercare program, what we would normally call parole, but for juveniles, we call it aftercare, is not sufficient. It's not providing the resources that children need when they leave the juvenile justice system. And so, as you can see, that pipeline begins with truancy and then, of course, post-incarceration. I need help. I need help from the community. That's one of the reasons why I'm trying to take part in as many meetings and discussions like this as possible, to let you know that I need help, that my office can't do this by myself. The police department can't do this by themselves. We have to do this as a community.
Thank you so much, Joe. We really appreciate the work that you're doing and also your candor and coming and telling people that you could use some help with that. So yeah, thank you so much. Our next panelist this evening is Nancy Maxwell. She is an activist and the president of Carbondale United. So let's turn it over to Nancy.
Thank you, Jennifer. So Carbondale United got formed because of the gun violence. It was not as great as it is now, but it has increased greatly. Since forming Carbondale United, I've lost a child to gun violence right here in this area. And that inspired me even more to look for solutions to this problem. I moved here originally from Chicago to bring my kids to a better life, a quieter life. And now that doesn't seem to be the option. This seems to be mirroring the actions and events that were happening in Chicago then. And I feel like if we don't get a hold of this right now, it's gonna only get worse. I don't want to see another child die. The student was really bad. I felt it all over again, from my son getting shot. So my goal in life is to pursue this. We've been doing virtual summits at Carbondale United when the pandemic was first came into existence. And since then, we've been doing outside events. Right now, we're doing community pop-ups where we're going to the community to try to reconnect and offer resources such as health resources, mental health resources, spiritual resources, education, employment, and any other thing that we come up with, legal services like getting your background clear. So we're going to community by community, not only in Marion, not only in Carbondale, but in Marion, and we also plan to include K-Roll on that list too. Because at the end of the day, we are all in Southern Illinois, and we can't just cure the violence in one area and expect it not to expect it to be cured all over. That's not going to happen. We have to hit the whole area at once. And so that's kind of what we're doing now with the community pop-ups. We're working real closely with Joe Cervantez, the state's attorney. I actually sit on his citizen board, and we are looking at ways on that board as well, or programs that we can come in to try to combat this problem. So thank you for inviting me and having me here today.
Thank you so much, Nancy. It was really good to hear what Carbondale United is doing. Our next panelist is Diana Brawley Sussman. She is the director of the Carbondale Public Library, and she's a member of Carbondale United. And she is going to talk a little bit about the Cure Violence program.
Okay, thank you. I want to talk about the nuts and bolts of Cure Violence, which is one potential violence prevention solution. And it's something that we came to learn a little bit more about over the course of the past year, thanks to some grant work that we did also in partnership with Carbondale United. So I want to talk from an administrative perspective, based on the trainings that we've received and some of the materials I've received about the program, and talk about what the nuts and bolts are. Because I think a lot of people have heard of Cure Violence. So I want to get a little bit literal with what that actually entails. So for starters, it's important to understand that violence acts like a disease. It behaves like a contagion, like an epidemic. And we've all become a little bit more familiar lately with how an epidemic behaves. So the characteristics that are similar are clustering, spreading, and transmission. Exposure to violence actually affects the individual person's brain, and then that puts them at risk of perpetuating and being a part of and being victim of further violence as well. Retaliation increases the spread, quite literally. And then social norms create clusters of violence. Violence works by detecting and interrupting conflicts as they arise, identifying and treating the highest risk individuals, and changing the social norms. It works really well. It's been around for actually quite a long time. Many years, and there have been some very formal studies done on it to show how well it works. Northwestern University did a study in Chicago in 2009 and found that Cure Violence reduced the number of shootings by somewhere between 41% and 73% in 2009. And they also saw a 100% reduction in retaliation killings. In 2012, Johns Hopkins University did a study in Baltimore on Cure Violence and found a 56% reduction in killings and a 34% reduction in shootings. In 2018, the John Jay College of Criminal Justice did a study in New York City and found a 63% reduction in killings in New York. So how does it work? What they do is hire specific roles, and Cure Violence trains communities in how to implement this. Those roles tend to be typically a program manager, a supervisor. I think in our case, being somewhat small, we could probably combine those. Outreach workers, violence interrupters, and hospital responders. So what they do is outreach workers each have a caseload of about 15 participants at all times. They basically are doing something like social work, essentially, with high-risk individuals, doing face-to-face communication with them and interaction with them, reaching out to them. Violence interrupters identify and detect violent events that are happening. They do that in communication also with the outreach workers, and they do conflict mediation. They keep their pulse on the community to see what is happening so that they know where they need to intervene, and then they do that intervention. Hospital responders work very much like rape crisis intervention workers. They show up at the hospital when violence has occurred, and they do violence interruption right there on the spot. Who you hire for cure violence is very important. People who do this work, they have to be credible with the people they're working with. They have to be streetwise, very well respected and connected in the community. They have to be able to relate to the highest risk participants. And sometimes they have been in these situations themselves and have been a part of that. So that adds to their credibility. And they have to, of course, be empathetic. The participants, the people who they then work with on their caseload, they should have at least 4 of the following characteristics. So these are the people who they're reaching out to. They should be somewhere between the ages of 16 and 25 years old, and or formerly incarcerated, previously shot, or have that type of experience among their friends, families, and peers. Active in a violent street organization, a history of violence, be an alleged weapons carrier, or engaged in high-risk street activity. So any 4 of those things would make a person a good candidate for someone who needs that type of casework or intervention. And then they build relationships with those high-risk individuals, and that allows them to get notified of potential shootings before they happen, to know when conflicts are brewing, to know when conflicts have escalated and are at the point where they need immediate intervention, to know when retaliation is about to occur or maybe about to occur, to know when violence has occurred, and to be introduced to individuals and groups in the neighborhood so that they can do their work. So funding, a lot of times it is grant funded. Funding for violence prevention has shown up in the budgets of police departments, health departments, human service agencies, institutions of higher learning, and community-based organizations. I want to say a little bit about law enforcement. That was the first one that is listed in Cure Violence material. It is very important, they emphasize this, that law enforcement understand the program. They understand what you're doing. When you're doing violence interruption work for Cure Violence, you're wearing a uniform. It's a t-shirt that says violence interrupter on it, so that that protects you somewhat and identifies what it is that you are up to. However, for the program to work, there needs to be separation between the program and law enforcement. They cannot act as informants, because violence interrupters have to maintain trust and credibility so that they will be safe, and also so that they will, so that people will tell them about potential violence brewing within the community. So it's a delicate relationship there. In terms of cost, I believe that, and this is a bit of a spitball figure here, so I apologize for that. I believe that you could probably implement a really basic cure violence program here conservatively for about $200,000, more or less, annually, though there are several cost variables to consider in terms of whether or not you're paying rent, how many employees you are employing, what you're paying them, whether or not you're providing them with benefits like health insurance, and how much Cure Violence ends up charging you for the training that they do. And in my experience, they've been quite flexible with those costs. So those are some things to consider. And there is a great deal of information on the Cure Violence Global website. So that's at cvg.org. Cure Violence Global is what that stands for, cvg.org. So those are just the nuts and bolts to keep in mind as we, as a community, consider this. I know that it's something that Carbondale United is very interested in playing a very active role in that.
Great. Thank you, Diana. That was really interesting. It sounds like a great program. So our next panelist is Clare Killman from the Dispute Resolution Institute, and she is going to talk about a new initiative that they are working on.
Thank you, Jennifer. So I think it's safe to say that we live in a pretty violent system that employs a logic of violence as a means of problem solving, both in our foreign and our domestic policies. And so it should surprise none of us when anyone in our population, specifically in Carbondale, picks up a gun and decides to employ the logic of violence themselves. That's just par for the course. It's how problems are solved in our community, and it's what we've taught our people. It's how we've taught our people how to resolve conflict. And so me and my colleagues at the Dispute Resolution Institute see community mediation as at least a partial solution to a set of problems that exist in our society, specifically around conflict resolution. Communities like Carbondale deserve for systems of care to replace systems and logics of violence, right? So we have to actively work to build those in order to make our communities less violent places. So it's this sort of kickoff toward the process of de-escalation. And the Dispute Resolution Institute is currently developing a robust community mediation program that hopes to have a broad impact on our community's ability to relate to one another. It's my personal hope that community mediation could de-escalate anything from disputes between, say, code enforcement and residents of Carbondale, all the way to like intra-neighborhood disputes. Hopefully, the end game is to de-escalate the conditions for violent actions before that logic winds up asserting itself between folks. Mediation is a process by which disputing parties have a facilitated discussion with a trained mediator who is there to ensure that, if not a resolution, which is always great, at least the mediator will be there to help deepen everyone's understanding of one another and hopefully relieve some of the rising tension, which is a noble cause. And the Dispute Resolution Institute is also proud to announce our community mediation program training, which will start November 13th, 2021, so this fall, and it will run through December. I'm going to pop a registration link down below in the chat. If anyone is interested in becoming a community mediator, we will train you for free if you want to volunteer.
Great. Thank you, Claire. That sounds like a great training and a good opportunity for people. So our next panelist is Chastity Mays from A Gift of Love, and she is going to talk a little bit about the work that her organization is doing.
Hi, my name is Chastity Mays. Thanks, Jennifer. So, A Gift of Love charity, we have a communication program. The name of that program is Mental Emancipation League. The program basically teaches people how to communicate with each other. And some people might think that that's very simple and we should all know how to do that already. But I don't think that we really understand how to communicate without violence and without violence inserted into that communication. So for example, like simply name calling each other, yelling, screaming, talking over each other. Those are all things that we do, and especially when emotions are involved and there's a heightened situation. And I feel like everybody needs to understand that you can talk about anything as long as you know how to communicate. Communicate, number one. Like you can talk about anything. You can cry, your feelings can be hurt, things can be heightened, but you can still have a great conversation. And on the other side of that, come out peacefully. And I think another thing that young people especially don't understand is that you can agree to disagree. So the conversation does not have to end in violence, because I cannot like what you said, you cannot like what I said, but we can agree on that problem and just move forward. We have implemented that program a few times in the community. Orlin Mays teaches the program. He has did that program actually at the Denman Center with youth. He has did that program at the Center for Empowerment and Justice. We do plan to implement the program moving forward in the future. The Denman Center is a place that we're looking to do that at, and there are several other places that we may be implementing the program. If anybody's interested, you can just contact me and I could tell you more, and we could also talk about implementing the program. I did want to add that I think that this is a really good conversation, that we're all coming together to work together to solve this problem in our community. I also think that we really need to involve youth voices, and that's hard to do, but it's definitely needed so we can find out what more can we do to help solve this problem. Thank you very much.
Thank you, Chastity. That is a really great idea, and maybe something we can think about if we are continuing this conversation series in the future. Also, do you think you could put a way that people could contact you into the chat? Great. Thank you so much. And that is a really good introduction to our next guest, because he is the general manager of the Denman Center. His name is Aaron Lee, and he's going to talk a little bit about the projects that they have going on at the Denman Center.
Thank you, and good evening, everyone. I'm just trying to figure out where to start. There's so much to say. To everyone's point, the gun violence that we're dealing with in our community has several layers. Obviously, it starts at home, but it also starts in the school. Many melanated young boys from grades 3 through 4th stop learning at that particular point. And I believe that's a big reason why there's truancy in our community. Because once a kid stops learning, coming to school becomes more and more difficult. And I think we need to get into the schools, educate our staff on asking those questions that may change the kid's life. Because I think clarifying questions for kids that don't necessarily have the resources to either be able to communicate or articulate their thoughts, I believe are vital to helping them continue to educate themselves. The Denman Center was founded by Justin Denman, a former Carbondale native who's played basketball professionally. And we got together and figured out a way that we thought we could help as a community, because it takes a village. And some of the programming that we're excited about is our Girls and Boys Empowerment Group. It's for young girls and boys ages 12 to 18. Dr. Patricia Blessman, a trauma psychiatrist out of Chicago, is putting that together for us. And as soon as we have enough funding for the curriculum, it's our goal to put that in place. It's a 6-week program to empower young ladies and young men to use their voices and become young people with a growth mindset versus a fixed mindset So we're very excited about that. Our Sunlight basketball program, through a partnership with State's Attorney's Office, we're really excited about our midnight to 3 a.m. basketball program. Many of the young men that will come to our program are coming for the opportunity to play. But once they get into our gym, they'll be able to interact with men, doctors, lawyers, professors, teachers that can have thoughtful and safe conversations with them about how to turn their lives around, whether that's getting their GED, helping them fill out a job application, or even walking into a courtroom with that individual and advocating for them on their behalf. So we're very excited about that program. It's something that we've done in Chicago, and it was very, very successful on the west side of Chicago. So we're very honored to be able to bring that to Carbondale. And we think with the help of all of the local churches and with Joe's organization assisting, we think it has an opportunity to have a great impact on gun violence, but also getting some of these young men back into school and into the workforce. So we're very excited about it. It's from 12 midnight on Friday nights to 3 a.m. Once the young men enter the building, we have a code of conduct that each young man signs, and that's their contract to come into the building. And once they come in at midnight, none of us leave until 3 o'clock, because those are peak crime hours in most cities. So we want to make sure that those kids who may not know how to say no have an opportunity to do that without using their voices, but can come to a safe place. And those kids who have gotten off to the wrong path have an opportunity to come and get some vastly needed support. So we're very excited about that. Our Why Me program is an initiative for juveniles coming out of the system to get mentors and possibly some housing that they could utilize if going to their environment is not a safe one. And so we're very excited about that program as well. But it starts at 3 levels: home, school, and community. We got to do a better job of training and interacting and advocating for young people at those 3 levels. And part of that is going to people's homes. If truancy is as big of an issue as we all think it is, we need to be able to interact with those families, interact with those teachers, and come to a resolution on how we can make school important and school enjoyable for those young people that have stopped coming. So I'm very honored to be involved with this distinguished panel. And there's just one more thing I'd like to mention. We're putting together a Black men's brunch. It's a brunch designed to bring 100 men together that are willing to commit to being mentors for some of these kids that have either been in the justice system or have not gone to school or not doing well academically. And the goal is to have 100 men commit to a year of mentoring a young man and helping us curb the truancy, the gun violence, and a lot of the other things that are a struggle in our community. And once again, thank you very much for the opportunity to be on the panel.
Wow, thank you so much, Aaron. It's really interesting to hear all the work that you are doing with the Denman Center, and we appreciate it. And it sounds like what you're doing is kind of right at the crux of some of these problems that are arising in the community. So thank you for that. And I'm really glad you could join us today. So our next panelist is Dollean York-Anderson. She is going to talk to us a little bit about the work that she is doing in the area of restorative justice. So Dollean.
Well, hello, everyone, and thank you for inviting me to participate. Can you all hear me? Okay, good. Family Advocacy Services is the agency that I oversee as the executive director. And I actually founded this program, this agency in 2005 as a not-for-profit program. Our agency works with families. We work with the parents, we work with the teenagers, and we work with the elementary age students. So the training that we provide to the families, we go to the homes. Pre-COVID, we would go into the homes when we had a child that was acting out through the after-school program that we were offering, and teach the parent how to communicate with their children in ways that children get an opportunity to genuinely express themselves. Oftentimes, children don't have the verbal tools to use, and we teach the parents how to help the child express that emotion that they might be going through. And keep in mind that as we have this increase in gun violence, we're talking about children who also may be traumatized, and they also may be traumatized by violence that they may see in their own homes. So we try to offer them a trauma-informed approach when we provide counseling for them through our after-school program. I'm a licensed clinical psychologist. One of the ways that we recruit is through SIU. And because I'm licensed, I can provide clinical supervision to students who can get credit, like from the social work department. We've done that over the years. So some of the programs that we've been able to do, providing programs for our youth, which we're doing right now through District 95, is a school-based mentoring program. Daniel Booth, who was the superintendent for District 95 when this program began, asked me to develop a school-based mentoring program to work with children who were having academic problems, social, emotional problems, or just behavioral problems in general. And so I recruited 30 senior, because I kind of wanted this to be a grandparent mentoring program for youth. And I recruited 30 seniors to go into the classroom, actually sit with the student. And when that child appeared to be distracted, the mentor would calm them down, or if necessary, take them out of the classroom and talk with them so that they were able to return to the classroom and actually participate in the learning. Prior to that, we were offering after-school programming at Hopewell Missionary Baptist Church through a grant funding from the Office of Minority Health, federally funded program. We received the subaward through SIU's Department of Education to offer after-school tutoring, mentoring. It was a year-round program that ended in 2009. It operated from 2006 to 2009 with that funding. And it was a year-round after-school program with a 6-week, 6-hour-a-day summer component of some of the activities for the children that were fun. For teenagers, we have received grants over the years. Teen Reach, some of you may be familiar with that type of funding. We offered the DARE program. We were approached by the Carbondale Police Department when they had their DARE funding, and to work with the parents and children to teach them about gang activities that their children did not need to be involved in, and teach the parents how to talk with their children about not being involved with gang activity at that time. We did that with a 2-year grant funding from the Carbondale Police Department. Programs that we've offered and in addition, for programs for teenagers, we had the Teen Pregnancy and Prevention grant funding from the Federal Department of Health and Human Services, a $1.5 million grant a year, to allow us to serve 3,500 students across 10 Southern Illinois counties, teaching them how to say no, as Aaron was saying, and build healthy lifestyle choices, build their self-confidence, and so forth. So those are some of the programs we've offered youth and teenagers. For parents, we received funding from the Illinois Department of Commerce and Economic Opportunity, the Digital Divide Program, some of you may be familiar with. We offered adults in the community some computer skills training, basic computer skills training, like how to turn a computer on and how to set up an email account and so forth. We offered family literacy skills, parenting skills, and of course, conflict resolution skills. And that's where I'm here today to deal with teach people how to, I think as Chastity was saying, communicate with one another. And in an effort to get people to communicate with one another, I'm interested in starting a community-wide collaborative restorative justice program. Are you all familiar with restorative justice? It's a program that's being taught in the at the middle school. It was last year at the middle school. Now it's at the high school. And you teach students to come together in circles, air their concerns, and to come to some type of agreement on how they're going to resolve their concerns, which can be an agreement to disagree. And but restorative justice, in addition to the mediation component that was addressed earlier, I don't remember, I think it was Clare maybe, but it deals with the feelings. It helps the people deal with the emotions, so that it's like an I feel when, because I feel upset when you do this, and they can come together and work out some differences. We have some partners who are going to work with us once we received some funding to establish this community-based restorative justice program. We not only want to work with the high school and the trainer over there who's working with the students, we want to develop a program that the community embraces, and there will be some buy-in from the community. At the high school and at the middle school, youth are being trained. Those youth are given some excellent skills on how to resolve conflict. But when they go home to interact with their untrained parents, and they go out into the community, for example, at one of the parks, and they deal with untrained community people, their skills that they've gotten in school are not able to be transferred to those other settings where they interact with other people and which may evolve into a conflict. So I've been working with the local churches to get them involved, with the Carbondale Police Department to refer people after they've done their paperwork on them, if they've had a conflict, refer them to a church, and the churches are agreeing to establish restorative justice ministries. And that person who was the victim, if they want to go and talk with a liaison at the church, would be able to do so, as well as bring his and her family in. And if the victim is comfortable enough, we would also invite the offender, so that they can sit down and work out their differences and hopefully reach some type of peaceful resolution. So if we get a lot of people in a lot of pockets, different community pockets, it will take time. But I think this restorative justice model on a collaborative basis will do much to reduce violence in the Carbondale community. So I'm looking for partners. I already have as partners the Carbondale Police Department, the Jackson County Sheriff's Office, the Jackson County Health Department, Southern Illinois Healthcare. Woody Thorne is going to be invested in working with us, as well as some local churches and some other businesses. Of course, we have the high school and the elementary school committed to helping us with this program as well. So if you're interested, please don't hesitate to contact me. And we are looking for funding. And like Diana said, it's going to take, for this program, roughly a couple of $100,000 to $300,000 to operate it. to get it off the ground. We'd like at least a 3-year funding period because the first year is going to pretty much be setting the program up. So thank you very much. I can't hear you.
Muted.
Sorry about that. I was saying thank you, Dollean. I really appreciate hearing some of the concrete ways that the community can help you. So maybe towards the end, we could have some of the other panelists who didn't really share that information tell us a little bit more about ways that we can help from the community. So I just want to thank all of the panelists for taking the time to tell us a little bit about what they're doing. And now we are going to open up to the next portion of the conversation, community comments and questions. So we are inviting you to speak. If you would like to speak, we will unmute you, allow you to talk. So if you would like to speak, go ahead and use the raise hand feature. We would like to hear about your experiences with gun violence or your thoughts on violence prevention. You can also ask questions. You are also more than welcome to put questions in the chat, which I know some of you have been doing. If you're watching this on Facebook, you can put questions in the comments section on Facebook. We are monitoring those. We're going to ask that you limit your comments and questions to about 2 minutes at max. Panelists are also going to be asked to limit their responses to about 2 minutes so that we can try to allow everyone to have some time to answer questions and to ask questions. So we're going to have Diana Brawley Sussman is going to help moderate this section of the evening. So she will go ahead and call on people who want to talk. So thank you.
Okay. And as people are raising their hands, I do want to go ahead and pose some questions that came in through the chat. And I also want to say that we are going to attempt to get to everybody's questions and comments, but can't promise that we'll be able to get there. But we'll do our best. So a question came in from Just Job. At what point does Cure Violence seem to start to have a noticeable effect? I can answer that one based on Cure Violence's website. Chicago saw a 48% shooting reduction in the first week of program implementation. And then Jane has asked, Cure Violence sounds very positive. Is there a plan to implement Cure here? My limited understanding is that a community has to bring governmental and community partners together and apply. And Carbondale United is sort of in the beginning phases of, we've done some research and we are hoping, as I understand, that would be something that Nancy is interested in. Nancy, you want to verify that? You got to unmute.
Yes, Carbondale United is interested in starting the Cure Violence program. And we are currently looking at grants and other means of funding to get it going. So that's a goal that I hope to see come to light here very soon.
Okay, and I think we're interested in community partners and funding opportunities and that kind of stuff. So people can send that your way. Carbondale United has a email address. It's carbondaleunited15@gmail.com. Okay, there's a question. I think this one is for Claire. How would law enforcement be involved with the mediation program? Would they refer cases, and would it be an alternative to the courts?
So it wouldn't be a court alternative. I don't like a lot of times, there are things that the court can handle that we can't, but we operate in concert with courts all the time. But to answer the question about law enforcement specifically, we're open to working with all community members to be a resource for cases where mediation is deemed appropriate. And the best part about community mediation programs is that they're based on community need. So we're able to be wherever our community needs us to resolve whatever disputes we're able to.
Thank you. And this question is for Joe, I believe. Sarah Beulah, I think I'm saying that because I think Joe might have this information. Somebody else might as well. Sarah Beulah has asked, is there a relationship between violence and a child's involvement with the DCFS and or foster care?
I believe that those situations are very case by case. There are certainly situations where agency involvement can exacerbate, or other people would call it an institutionalizing of a child with the system. And so, we have a very large juvenile, docket here in Jackson County. And I'm certain there's cases where it can have a negative effect on a child, especially siblings. One thing that I'm particularly interested in are the siblings of children who have been deemed delinquent or involved in criminal activity. The siblings have a very high rate of incarceration or criminal activity. And so it's one of the identifiers that I want to look at in the future, and try to figure out a way how to connect those individuals, those children, to different programs and organizations like you're speaking about, because it is a group that does have a high probability of coming involved with law enforcement.
Thank you. I believe this one might be for Aaron. Actually, I'm sure it's for Aaron. Lynn Davis has said there's so much good work being done at the Denman Center, and I think she's not the only person to have put some compliments out there. She's not familiar with where it is. Can you tell us where it is, Aaron?
Yes, ma'am. It's the old Carbondale High School, 880 West Street.
I can tell you're in there. You're in the gym.
Yes, I am.
Which has been beautifully restored. Okay, I think this one is for Dollean. Brandon Stokes has asked, how do we address students and children who are experiencing a negative parent-child relationship, family distress, or poor supervision? Oh, you got to unmute yourself. Sorry, Dollean.
Sorry, that's a very good question. I said, one of the things we try to do, like I said earlier, is teach the parent how to constructively and effectively talk with their child. And if necessary, we provide them with, I provide them with family counseling pro bono. So we want to teach the child the skills, but the parent is the essential person in that group, or that dyad, to help the child learn how to communicate more effectively with him or her.
Thank you. I'm going to go ahead and go to a hand raised and then get back to some things that have come in through the chat. So Darlene Roper has had a hand up for a little bit. Darlene, we're going to have Liz give you the opportunity to unmute so you can voice your question.
Can you hear me?
We sure can.
Okay, so a lot of you, I was listening, I'm just a member of the community. So I was listening to a lot of you guys talk and different ideas, which are great. But what I would like to really see in the community is you guys to figure out how to reach the age group from junior high to high school, because those are our high-risk youth. And right now, the African-American community, these children are struggling. They need real support. And I hear people saying like the police and stuff like that, but we all know that these youth are not going to be more open to go and deal with the police. So why not use some of those resources and get the men and women in the community, employ them. That Denman Center is huge. These kids can go to, they can get tutoring, they can get all the different ideas everyone was saying. I've talked to a young man who has never even been to the zoo before. He was 18 years old. Like, there need to be African Americans. You guys need to use some of those resources and get the African American men and women out in the community that's willing to go knock on doors for these children. Not talk to parents. That's not afraid to go and knock on doors and talk to parents. And then a African American male will really listen to another male, African American male, a positive role model, and especially if someone who's willing to be consistent and stay on them and constantly knock on that door when they're out and about. I would love to see some of those resources be put into employing African Americans in the community, and know that most of these children are going to be rebellious when it comes to dealing with the police. They're not going to go out and deal with the police like that. And that Denman Center is a great place. And then he was saying something about these women and men are coming out, willing to come out and be out there and mentor with these children. Give it a chance. Let's look into the community with these troubled African American youth that where most of the gun violence is taking place. Put a real focus on them. Think about it. Are they going to be willing to go deal with putting some of that money into the community, the African American community, and let some of them go knock on them doors and
Darlene?
watch you see your change? Because it takes us. Yes.
Oh, I'm sorry. I didn't mean to interrupt. I thought I heard
Can
a
you hear me?
pause. Yeah. You're breaking up a little bit, but.
But it takes us. It takes us to get on. Or someone says about the parents. It takes another parent to get on a parent and let them know, hey, you care about your child as much as I care about your child. Consistent and not afraid to knock on those doors. And the only way you can do that is put some African American people that's willing to get out there and knock on those doors and get those children out of those violent situations. Some of these children don't have a choice. They're stuck in those situations. I'm one of those children that was stuck in those situations. And nobody helped me out of it. I had to help myself out. It took one lady that stayed consistent with me, kept going to get me, kept going, and that's how I got out and where I am at today. So
Thank you.
I just would love to see that. Yeah, you're welcome.
Thank you so much, Darlene, for sharing all that. I know Aaron has his hand up, and I think you might be recruited to be a volunteer. Aaron, do you want to address Darlene's thoughtful comments, please?
Yes, Ms. Roper, thank you for that passionate and eloquent advocacy for those youth. But I will say this, that's one of the main goals of the Black Men's Brunch, is to recruit 100 men that are willing to do exactly what you're talking about. And in fact, several of us have visited every school in the school district to get volunteer applications so that we can go into those communities, parish school through the middle school. I completely agree with you. There has to be a different level of advocacy other than law enforcement, although law enforcement obviously has its place in helping in a community, but it has to start with the individuals that look like the other individuals that are often in distress. And so that is part of the process. The Boys and Girls Empowerment Group is also part of that process, because we have to empower young people to think outside of what they can see. Right now, they can only see their communities. So therefore, many of them have what we call a fixed mindset. This empowerment group is designed to have them have a growth mindset, whether that be through financial literacy, entrepreneurship, whatever that looks like for them, agriculture and farming. So we have those things in place. But I did want to just thank you once again for that passionate synopsis of what we're in need of. And you're absolutely spot on. We've got to fix what's broken. And we're in the process of doing that. Once again, thank you very much for your comments.
Okay. And please, if anybody wants to raise their hand, we will get to you to let you speak as well. And I do have some more in the chat to go through.
It looks like Dollean has her hand raised as well. Maybe she
Oh,
wants
okay,
to
awesome.
respond.
Thank you, Dollean. Please do.
I agree with everything that Darlene said, and I appreciate the focus on young people and youth. We got to also work with the parents. Sometimes I think the parents need more help than some of our youth, because they are the first role models that the children have. We need to teach them about the value of participating in school activities, going to the parent-teacher conferences. Don't just wait until you're so aggravated and upset that you go up there and cause a ruckus. So I think working with the parents over the years that I have done, we've offered parents training, and they come, and we had a 98% participation rate, because in our programs, when they enroll their child, they have to enroll themselves. And we gave them a lot of information and assistance on how to parent. We didn't call it that because we didn't want them to think that we thought they didn't know how to parent, but there are some essential skills that they must learn in order to help their children. So I appreciate the focus on children. We also have to work with the parents.
I see some comments and a question from Crawford Wilson in the chat. And I also see that Crawford has a hand up. So Crawford, if we unmute you, would you be willing to voice your comments and questions for us? Liz will go ahead and send you an unmute request. There you go.
Yeah, I'm going to defer to my wife at this time.
I'm the one who have the comment, but I'm not on a computer.
Okay.
I need to take some of those computer skills that somebody was dishing out. Okay, so I want to address the DCFS and foster care system. I am a veteran of DCFS, now retired, hallelujah. And I just wanted to kind of make something clear with the community. DCFS job is to protect children from, and to determine whether the situation they are in is just risk or if the child is unsafe. And if we cannot determine that the child can remain safe in his or her home, that's when a child goes to foster care. So think about this. You have a child in foster care who could not respect or do the things his or her parents want them to do. And then we put this expectation on foster parents to get this kid right. Let's think about that. So this is a child who can't be respectful to his or her parents and do what they ask them to do. And now we've taken them away. The system has taken them away and placed them with the family they don't really know. They don't know how to move around in that system quite yet. And I asked us as a community to be supportive and not critical of a child that's in foster care. This child has already been through losing his family because of his or her behavior and being placed in a strange environment. And I also want to say that I worked in corrections, and yes, a lot of the inmates I worked in a community correctional center. So we had a lot more involvement with those inmates than you would say in a normal prison environment. And I did meet quite a few young men. I worked in a male facility, young men who said, yes, they grew up in foster care. And so there is sometimes a connection, but I don't think there's been enough research done on it. But I personally met some inmates who said, I grew up in foster care and I kind of knew I wasn't gonna make it. So we have to think about that mindset of a child who has come out of their homes, gone into foster care, first one feeling neglected by their natural family, and then feeling like now I'm going to these people that I don't even know, and what kind of mindset those children are in. The other thing too is I'm willing to work with Darlene, the police, or anybody. Just call me. But I wasn't on the computer tonight, but Crawford Wilson is my husband. So if you get in contact with him, he can locate me, and I'd be willing to work with any of the organizations on reaching our kids, but not just reaching our kids, but reaching parents and foster parents. Just let me know what I can do to help.
Thank you. You know what you guys can do, if you're able, is in the chat, if you want to send contact information just to the panelists, you just choose to send it to the panelists rather than everybody in the room. That might give some of us who are working on these programs the ability to contact you. I do want to also mention that there were a couple of other questions that came from the two of you. One starts with a comment, doing and being are closely related. And if you feel good about who you are and you feel good and competent about what you do, are there any programs addressing self-esteem issues that deal with how a person sees and feels about themselves? Anybody want to take that one? I think it might be part of some of the programs that are being developed or already. Dollean, how about you?
Yes. Through our school-based mentoring program and through our after-school programs that we've offered over the years, the Teen Reach program, the pregnancy prevention program, we've always addressed self-esteem. As the mentors now are working with the students in grades 2 through 5 at District 95, some of the children are referred to the program for social emotional types of problems. And I've been working with getting training for the mentors on how to use the little emoji feelings, faces and so forth, because like I said before, the children don't often have the tools to be able to express themselves verbally, but we can show them other ways and other techniques that we can help them communicate with us. But building self-esteem is one of the things that our program focuses on, especially with the mentoring component. And we build their confidence, letting them know that they can do things. We are virtually taking the children since COVID. We've arranged for them to virtually take children to Africa, to different places, because as somebody said earlier, some of our children have never been exposed outside of Carbondale, but there are virtual ways that you can do that, and showing students people who look like themselves in positive and prestigious or whatever kind of constructive positions, that's also a self-esteem building. And we've had people come in to talk to students about how they got to be where they are. So we encourage self-esteem building, but we also let the parents know that once we built them up, they can't go home and get torn down. So we have to work with the parents. We must.
Thank you. I see a hand up from Darlene Roper again, and I do want to give you another chance to speak, maybe just once, because I do have a lot of other questions and stuff. But if your hand is still up and you want to speak, we'll mute you and give you a chance to say something again.
Can you hear me?
Yes.
Can you hear me?
Yes.
Okay, back on the self-esteem issue, I think that's a great idea, because a lot of our young Black youth don't feel they don't have great self-esteem. They can't express who they are. The system is built to tear them down. So I would like to see, like I said, once again, going back to that huge Denman Center, for once we can have a real Black History Month without the slave part of our history. Let's talk about we have some brilliant ancestors and some other things like we can do to build our Black youth up, to let them know that they can be more than just slaves and drug dealers and victims of violence or, trauma. Let's introduce them to how Black can be excellent. That's great. Start there. I'm telling you, that's what you guys need to do. But that's all.
Thank you. Let's see. There is a question for Claire. Jane Otte has asked, what is the experience of the Dispute Resolution Center with violent situations, which is the subject of tonight?
Yes, so we have experience in our family mediation program with handling domestic violence child custody cases throughout our region. The community mediation program is certainly an exciting place for us to continue to grow and expand our services, specifically those related to helping heal violent systems, violent ways. Our mediators are all trained on how to deal with violent situations as they arise, but as far as like violent scenarios, we're always here to support and work with the community to support in any way that we can, and that includes helping to bring in resources and training, etc., so that we can support the community.
Thank you. I think this question might go to Joe because I know he's been working on some of this, but others may want to talk about this as well. Crawford Wilson has asked, has there or is there a root cause analysis that's been conducted in the Carbondale community?
I am working on that. Thank you for the question. It's one of the issues that I tackled right away, and information is starting to pour into me right now about what's been going on in the community. I think that generally, for as advanced as we are technology-wise, we do a very poor job of information sharing. And I think that needs to be fixed. And so one of the first things we did on Friday, some of you have heard me say this, some of the community members haven't, is the first day that I was in office, we met with the chancellor of the university, and we do have a data collection project going right now. We have over 20 SIU students who work in our office off and on, and their job is to go through our files here and get data that we weren't collecting before. What I felt like is that the criminal justice system had become a sort of assembly line process, and it's very difficult to keep to adjust and know what programs work, what things don't work, unless you have the data. And right now, I feel like we're flying blind. So one of my struggles has been trying to get a fix on exactly where the problem is and how to, in order to fix it. And so our data is starting to be collected. Some of the things have come out earlier than others, but we're also working on a way, these grad students and professors are working on a way for me to implement that. And so going forward, every time we close a file, we're getting important social data, background, race, status, family status, neighborhoods. And when we collect that data, we'll be able to share that with the public. In fact, we're gonna hope to put a page on our website, a tab where the community can go and look at criminal justice statistics for Jackson County. As far as I know, it might be the first one in Illinois that does that. There's very few information sharing state's attorney's offices or law enforcement offices. A lot of times you have to FOIA this information. And why should we have to FOIA information that is public information that could help us out today? And so it's going to be a struggle. If it's the only thing I do in 4 years, that's the one thing I'm going to do if it kills me. So we're working on that right now. And as soon as we get data, I'll start sharing it. The first piece of the data that I've gotten is what we've done as far as incarceration from our office over the last few years, the racial background, the numbers of people who've been incarcerated, what kind of crimes are being incarcerated for, so on and so forth. So we're working on that data. And now we have a really good information sharing program with the Carbondale Police Department, where I'm getting updated information as it happens, not just police reports, but also shootings. And so we'll continue to work on trying to get this down and find out what the problem is, where it is. I've definitely targeted the age groups of things that are happening. And now I'm having a lot of trouble trying to get your community programs and programs that I'm backing up. I'm having a hard time getting the kids into them that need to be into them. The captive audiences are in the high school. Another captive audience is in the criminal justice system, unfortunately. But so many of the kids that are in the criminal justice system right now, I have trouble getting to them and their parents, even though they're here in the courthouse, and referring them to programs. And so one of the reasons is because of information sharing. So I think that it's a problem, and I keep working on to make sure our information sharing is good with juveniles. At the same time, I need and one of the things I'd like to suggest is all these different programs are great, but I would suggest one place, one guide, one handbook that has a collected programs and organizations information in it that's given to high school counselors, junior high counselors, the Denman Center, at the Boys and Girls Club, at social workers' offices, at DCFS, so that we're all on the same page and we know exactly where to go and who to call if this particular child is in need of something. Right now, there's so many programs and so many of us that want to do good, but at the same time, there's a lot going on. And I feel like if we pull our resources and get that guide, a community guide to programs or programming and such, and get that out on an annual basis, updated every year, come together. I'll find the funding for it somewhere. We'll publish it. We'll have it online, but I'll also publish it and put it in the hands of people so that I can get kids to the right place. Sometimes I call places for help and they say, we don't do that anymore, or the number's disconnected. But I have an opportunity to get kids who are not gone. They're not gone yet. They're in our system. They've been in trouble, but I'm not going to give up on them. I have an opportunity to get them to your programs that you're doing, but I need the way to do that. And I'm still trying to figure that out right now.
Thank you so much. It's a great idea. Ella Lacey has asked for consideration of gun violence prevention. Are any of the panelists aware of an effort that borrows from the underlying philosophy of martial arts where there might be training in safe use of weapons? Anyone?
Well,
I didn't hear that. Can you
Want me to repeat that? Sure. Ella Lacey had asked for consideration of gun violence prevention. Are there any panelists aware of any efforts that borrow from the underlying philosophy of martial arts where there might be training in safe use of weapons?
Looks like Nancy might have had something to say on that.
Okay.
I was just about to say, at the community pop-up, so far everyone we've had the martial arts team out there doing some exercises with the kids that seems kind of successful. And I've been talking to Gift of Love Charity because they have somebody on there that's a black belt that can give out some lessons. One of the biggest problems with all of this is where we have these buildings, the Denman Center, but we need the funding so that building can be finished. We need somewhere to have all these activities at. Right now, the things that we're doing in the community, we're doing it outside. It's about to get cold, and that's going to go to a standstill. We need a building where all these things can be housed at, because right now we don't have that. And I do want to say with the foster care and the system, somewhere along the line, we're banking on parents that the child made a mistake with the parents. Sometimes it's not the child. Sometimes it's the parents. It may be mental health, which we're lacking in services down here. Or sometimes it's drug abuse, and they're not doing what they need to do with the child. I am a product of the foster care system for a brief time. And it was because my mother was mentally sick and my father drank because he couldn't deal with what was going on with her. So I think we need to look at not only at the parents, look at the parents in a different light, because sometimes they can't even help themselves, let's know their child. I don't care how much talking you do to them. Mental health is not something you can just talk out. It's something, a progression over time. And shoot, I forgot just so quick what I was about to say. But I don't know what I'll come back when I think of it. I got so into that I lost myself.
Right. Thank you,
just wanted to
Nancy.
point that out, that it's just not always, and it's not always the kids in school, because some of these shooters and people we have here are not even going to school. So they missing out on all the opportunities of what's happening. So what do we have in place to help the children that are not in school, or the children who have parents who can't even help themselves? These are the things that Carbondale United is looking at.
Thank you.
So it looks like we have a couple of hands raised, and we could possibly have time for a couple more questions, and then we probably need to switch to the next little segment before we end for the evening, because we don't want to keep you all forever. So we go ahead and maybe see what some of these hands have to say.
Yeah, it looks like Denise Drew has her hand up. And you're unmuted, Denise. I think we should be able to hear you.
Thank you so much. To the state's attorney's point about the handbook, I know this is primarily based in Carbondale right now, but many of our youth are transient, going from county to county and community to community. So just a thought, as this handbook is beginning to be developed, can we reach out to the other counties and the other communities? That way we may be duplicating services and pull our resources together. That way we can have the maximum effect for the youth here in Southern Illinois at large. Thank you.
I want to point out something that that's very related to that, and that came up in the text from Jess Job. SIH hosts a Healthy Southern Illinois Delta Network website, which has many resource guides, and a community violence prevention guide could very likely be placed on that site and be easily updated. The Community Benefits Department at SIH hosts that site. So she put the link to that in the chat. And I think that would be a region-wide resource. Shannon Green has a hand up. Oh, let's see. We got to unmute her or him. Thank you.
Hi.
Hi.
So that's actually my supervisor's name.
Oh,
I didn't
sorry.
realize that was the name on here. I'm Amanda.
Hi, Amanda.
So I just had seen some questions from Sarah in the chat. I'm not sure what her last name is, or how to pronounce it. But she brought up some pretty interesting, good questions that I thought could have been answered. But one of them was asking Aaron about the initiative to recruit Black men to mentor young Black men, and that it sounds great. But do we also run the risk of defining violence and gun violence as a Black or African American problem, even though there are other races, white, Asian, Hispanic, that are involved in violent acts and violent situations? And how do we combat perpetuating the stereotype of young men committing violence, young Black men committing violence? Yeah, that's kind of the overall question that I had.
Okay, so we've got two people who had that same question. It sounds like yourself and Sarah. Aaron, do you want to address that?
Yes, please. That's a great question. But if we're being completely honest, that narrative is already out there. Young men of color are often portrayed as those particular individuals, although statistics would say most violent crimes are committed by Caucasian men and not melanated men. So the narrative and reality is two different things. But I will say this to answer your question more in depth. The reason that we're all here, and I'll be very frank, most of the violence at this moment is happening in communities where there's melanated people. That's where the crimes and the shootings are taking place. Those are the individuals that the panelists, myself and Joe and others are dealing with. So that narrative does need to be changed. I definitely agree with you. That's a long-term process. But short-term, the 911, the emergency, the pandemic is in the community where melanated people live on a number of levels, not just gun violence. There's a lot of systemic issues that are impacting some of the gun violence somebody that mentioned poverty. There is a direct correlation between poverty and crime. But I do want to make a distinct difference. It's a difference between poverty and poor. Poverty is the condition you live in. Poor is the mindset that you have. Those are two vastly different things. But crime and poverty do usually come hand in hand because of lack of resources, lack of education, lack of alternative opportunities. And I hope I answered your question in a very thoughtful and thorough way.
Yes, thank you so much, Aaron. So I think we are now going to move to this next little short portion of the evening. I really appreciate everyone answering all the questions. So what I am asking for is if you all have any ideas for our next community conversation, if you could put those in the chat and let us know how you think we could move or expand upon this conversation, if we could take it in a different direction. If there's any suggestions that you have, we would love to hear them. I also want to give the panelists the opportunity to just quickly, like 1 minute or less, just tell us what the community could do to help you. I know a couple of you have touched upon it already, but I'd like to hear from the rest of you and just let us know how we can help. And I think then we will call it an evening. So Joe, I think you had mentioned it a little bit before, but do you want to repeat it?
I'm sorry, you kind of cut out a little bit.
Oh, I'm sorry. Yeah, I'm just asking how the community can help you. Do you mind just briefly sharing?
Yeah, so continue to do what you're doing and innovate and come up with ideas and be creative. I want to try to get these kids and different young adults into different programs and give them resources, not just programs. And I have an opportunity to do it. It's a lot more difficult than what I thought it would be because I have a system that's been moving on, and it's hard to change that, but we're doing work to try to do that. What can be done right now? I know there was a question specifically about some of my programs are long and take time to implement. And I have to do that. I have to make sure that we don't just change something right now, but that we change the way we think about violence, the way we think about crime, and the way we think about prosecution. And so I'm going to continue to do that. But right now, the most important thing is to cooperate as much as you can with law enforcement and try to change the narrative for young men and women. It's eye-opening that even individuals that have been harmed themselves, shot themselves, will not provide a statement for me to help them. And sometimes that's all I need. And while we want to help young men and women and get them right again, at the same time, we have to make sure the community is safe. What good are great schools if you can't be safe in them? What good is a great park for kids to play in if it's not safe to go there? How great is the Denman Center if it's dangerous on your way there? We have to make sure our neighborhoods are safe. And if anything, let them know that I'm here to listen and that law enforcement will do whatever they can if there's some type of cooperation. But it starts there when it comes to public safety. And no matter how many programs we do, ultimately, we have to turn to cooperating with each other, communicating, and working together to make sure our streets are safe.
Great, thank you so much. How about Nancy? How can the community help with what you have going on?
Well, as I stated before, a lot of these things can be implemented if we have brick and mortar, if we have a place that's set up for some of these programs to become active. So right now, Carbondale, the city of Carbondale has $7.8 million. The county, Jackson County, has $11 million. I'm asking any and everybody to come to city council meeting next week and use your voice so we can get some of that money to repair the Denman Center, to get it all the way open so we can start providing some of these programs and initiatives. Thank you.
Thank you so much, Nancy. Let's go ahead. Diana, do you have anything you would like to add about how the community could help with cure violence or?
Well, I'll just say this, if for each of these programs, if you are interested in helping in some way, if you want to reach out through the Carbondale Public Library's Facebook page and click on contact us, that email will go to me and let me know who it is that you're wanting to help or which program it is that you're interested in helping with. And I will forward your email address to the appropriate panelist to put you in touch with them.
Great. That is a very nice offer, and I'm sure you will get some messages about that. Okay, let's go ahead and move to Claire. Claire, how can we help you?
So I think having more conversations like this is a good start, but I think that we as a community need to deepen and broaden our philosophical understanding of violence, where like when someone picks up a gun and uses that as a tool to commit a violent act, it doesn't happen in isolation. There is an entire framework of violence operating there. At the Dispute Resolution Institute, I deal with evictions and foreclosures and farmers who are suffering under, large banks. And, is an eviction not a violent act? Is a foreclosure a violent act? And there are just lingering philosophical questions that I think we have to answer as a community. I think that one thing that our community mediation program is poised to do is answer those really creatively and flexibly based on Carbondale's needs. And so if you'd like to join up and become a community mediator, I'm gonna drop the training link again in the chat below.
Great. Thank you so much for that perspective. Let's go ahead and move to Chastity. Chastity, how could we help your organization and your work?
We definitely always need volunteers. I'll throw my email and phone number in the chat once again. You can contact me if you want to volunteer. But I do want to add, we get grants along the way. So if we receive funding and you're already volunteering, that could turn into an employment opportunity for you. So just let me know if you want to become involved and how you want to help. I want to reiterate what Nancy said about the city council meeting. I think it's so important to get involved in that type of way. Go to that city council meeting and know that your voice matters, and we need to hear from you, your opinions about what you feel is going on in the city, and you can always speak during public comments about whatever it is you want to speak about.
Thank you, Chastity. It looks like you put in the chat that the next city council meeting is September 28th at 6 p.m. and you have to email the city to be able to attend the meeting via Zoom. So that is good for people to know. So thank you. And let's go ahead and move to Erin Lee. Erin, how can we help support the work you're doing at the Denman Center?
Thank you. I wanted to echo Claire's sentiments. We've got to continue to have these conversations. And we need three things: communication, collaboration, and grace. But I think at some point our conversations need to become uncomfortable, because the uncomfortable conversations is what gets us to where we all want to go. And with that being said, I want to recommend a book and a potential another opportunity for communication. There's a book called Uncomfortable Conversations with a Black Boy by Emmanuel Anchu. It's a very, very good book, and it sheds a lot of light on the questions that open up the think box, not only for Black melanated boys, but for people in general, regardless of your race or your gender. It would be a really good opportunity, and the book is on Audible as well. And we could get a group together to read the book and then come together and have some of those difficult conversations that tend to lend itself to movement and powerful impact in our communities. Because when we become uncomfortable, things tend to happen. I've never cut my grass from my couch. And so I believe being comfortable, being uncomfortable makes us all successful. And I think a book like this would be a great opportunity for us to have more in-depth conversations, and not just conversations on the surface, But I've been very, very excited about the conversation tonight. I want to thank the library for putting it together and all of our distinguished panels. And let's continue to talk. Thank you.
Great. Thank you so much. Yes, I agree. We need to continue to talk. And I love the idea of deepening and broadening these conversations as well. So if anyone has suggestions, just reach out as far as this series is concerned. And I'm sure there will be more conversations happening throughout the community as well. So our last panelist, Dollean York-Anderson, I know you touched upon it a little bit earlier, but how can we help support your work?
Thank you. In two ways, actually. I've spoken about a desire to establish a comprehensive, collaborative, community-wide restorative justice program. That's one of the ways in which we can create safe communities, create opportunities to have people get together and work out their differences and talk about the feelings that go along with what happened in their attempt to resolve that conflict. As I said before, I think it's wonderful that restorative justice practices are being taught to our youth, but let's face it, the children in the home are the least powerful person in the home. So if the parents and other community members could receive that training on how to resolve conflict in peaceful ways, I think that would lend its hand a lot in creating Carbondale as a safe place. I do not live in Carbondale. All of my business is in Carbondale. My private practice is in Carbondale. So I'm not able to come to a city council meeting and be of any use, because when you go up to talk, they ask for your address. The second way in which you all could help, in addition to partnering with this grant proposal that I'm seeking to write, is to volunteer to serve as a mentor for one of our students in the elementary school, District 95, grades 2 through 5. And if you're interested in doing that, it's a self-esteem building program. Please contact me. Thank you.
Great. Thank you so much. Well, this concludes our program for the evening. So I want to go ahead and say thank you to our panelists, Joe Cervantez, Nancy Maxwell, Diana Brawley Sussman, Chastity Mays, Clare Killman, Aaron Lee, and Dollean York-Anderson. I want to thank everyone who participated today. We had a good turnout, which is just wonderful that you all are invested in trying to make change in the community. I want to thank the American Library Association for the grant, Carbondale United, Dr. Linda Flowers and the Carbondale branch NAACP, Liz Hartman for helping behind the scenes, Diana Brawley Sussman for her help with the moderating the conversation and for helping with planning, and everyone who attended. So hopefully we will see you again soon. Thank you all so much and have a wonderful night.